You're fine. It's normal. That's just part of being a woman. How many times have you heard that? Painful periods, extreme fatigue, bloating that makes you look pregnant, hair shedding, mood swings that feel uncontrollable. You go to the doctor, you explain your symptoms, and you're told everything is normal. But what if it's not? Today we're talking about symptoms women are told are normal, but often signal something deeper. And if you've ever felt dismissed, unheard, or gaslit about your health, this video is for you. Because here's the truth no one tells you. The medical system was not built with women in mind. For decades, clinical trials excluded women. Research was done on male subjects, and that definition of normal was applied to women anyway. So when you feel like something is wrong and you're told you're fine, it's not your imagination. That ends today. This video is not medical advice, it's educational. If something feels wrong in your body, advocate for yourself and seek professional evaluation. But let's start calling out what should not be normalized. 1. Debilitating period pain. You've probably heard periods are supposed to hurt. Mild cramping, common, but pain so bad you miss work, vomit, faint, can't walk upright. That is not normal. And here's something that should make you angry. On average, it takes 7 to 10 years for a woman to be diagnosed with endometriosis, a condition that has a name, a diagnosis, and treatment options. Severe menstrual pain can be linked to endometriosis, where tissue similar to the uterine lining grows outside the uterus, fibroids, non-cancerous growths in or around the uterus, adenomyosis, where that same tissue grows into the uterine wall, hormonal imbalances, particularly elevated prostaglandins, which drive intense cramping. If pain controls your life every month, that's a red flag. Your period should not feel like a monthly medical emergency. 2. Extreme fatigue. Being tired sometimes is normal, but feeling exhausted no matter how much you sleep, not normal. Chronic fatigue in women can be linked to iron deficiency anemia, one of the most common and most overlooked causes in women, especially those with heavy periods. Thyroid disorders, particularly hypothyroidism, which disproportionately affects women. Hormonal imbalance, low estrogen, low progesterone, or both. Adrenal fatigue and chronic stress, your body running on empty for too long. Autoimmune conditions like lupus or fibromyalgia, which are more prevalent in women. Sleep apnea, frequently underdiagnosed in women because the symptoms present differently than they do in men. If you wake up tired every day, if caffeine barely works anymore, if you feel drained for weeks or months and can't explain why, that deserves investigation. Exhaustion that doesn't resolve with rest is a symptom, not a personality trait. Heavy period bleeding? Changing a pad or tampon every hour? Passing large clots? Bleeding for longer than 7 days? That is not just a heavy flow. The medical term is menorrhagia, and it is a recognized condition, not a personality quirk. Heavy bleeding can indicate fibroids pressing on the uterine lining, hormone imbalance, particularly estrogen dominance or low progesterone, clotting disorders like von Willebrand disease, which is frequently missed in women, endometrial polyps or hyperplasia, thyroid dysfunction, and here's the secondary consequence almost no one talks about. Losing that much blood monthly leads to iron deficiency anemia, which causes fatigue, brain fog, and dizziness. So if you're exhausted all the time and you have heavy periods, these two things are likely connected. Both are treatable. 4. Severe bloating. A little bloating before your period, common. But if you look 5 to 6 months pregnant on a daily basis, feel painful pressure in your abdomen, can't button your pants by the end of the day, that is not just normal PMS. Persistent bloating may relate to IBS, which affects more women than men, often dismissed as stress. Food sensitivities, particularly to gluten, dairy, or FODMAPs, gut microbiome imbalance, ovarian cysts, which cause pressure women mistake for digestive issues, estrogen dominance, which drives water retention and bloating throughout the cycle, SIBO, small intestinal bacterial overgrowth. Your stomach should not constantly feel inflamed. Track when it happens, what you ate, and where you are in your cycle. Patterns matter. 5. Hair thinning. Shedding 50 to 100 hairs per day? Normal. Noticeable thinning, bald patches, hairline recession? Not normal. Hair loss in women can signal thyroid dysfunction. Both hypothyroidism and hyperthyroidism disrupt the hair growth cycle. PCOS, elevated androgens cause hair follicles to shrink. Stress overload can trigger telogen effluvium, where large amounts of hair shed suddenly. Nutrient deficiencies, particularly iron, zinc, biotin, and vitamin D. Hormonal shifts, postpartum or during perimenopause. Hair loss is a lagging indicator. By the time you notice clumps in the shower, the cause happened weeks or months ago. That's why a full panel matters, not just your thyroid looks fine. 6. Mood swings that feel extreme. Feeling emotional before your period is common, but if you experience severe depression that arrives like clockwork before your period, intense, disproportionate anger that damages your relationships, anxiety attacks that feel impossible to control, a sense of dread or hopelessness that lifts suddenly when your period starts, that may not be just PMS. There is a real diagnosable condition called PMDD, premenstrual dysphoric disorder. It's not a mood disorder, it's a hormone sensitivity disorder. Hormone levels may be normal, but the brain's response to fluctuations is intense and disruptive. PMDD responds to treatment. Beyond PMDD, extreme mood changes can also point to perimenopause, which can begin as early as the late 30s, thyroid imbalances, magnesium and B6 deficiency, both strongly linked to mood regulation across the cycle. If you feel like a different person in the week before your period, that's data. Track it. Bring it to someone who will take it seriously. 7. Pain during intimacy. Pain during sex is one of the most commonly dismissed symptoms women report, but intimacy should not feel sharp, burning, or unbearable, and you should never have to just relax or push through it. Possible causes include endometriosis. Deep penetration can be especially painful when tissue grows near the ovaries or bowel. Pelvic floor dysfunction, where the muscles are too tight rather than too weak. Hormonal dryness, particularly during perimenopause or the postpartum period. Vulvodynia, chronic vulvar pain with no obvious cause but very real treatment options. Vaginismus, involuntary muscle spasms. Undiagnosed infections or skin conditions. This is not a you problem. This is not in your head. If something hurts repeatedly, your body is communicating something. Find a pelvic floor physical therapist or a gynecologist who specializes in vulvovaginal health. These specialists exist. You deserve access to them. 8. Rapid or unexplained weight changes. Sudden weight gain or unexplained weight loss without a change in diet or activity level? Not normal without investigation. Unexplained weight gain can be linked to hypothyroidism, your metabolism slows significantly. PCOS, insulin resistance causes the body to store fat, particularly around the abdomen. Cortisol dysregulation, chronic stress tells the body to hold on to weight. Perimenopause, shifting estrogen levels change where and how fat is distributed. Unexplained weight loss can point to hyperthyroidism, autoimmune conditions, or blood sugar and absorption issues. If the scale is moving without explanation, your hormones and thyroid deserve a much closer look. 9. Why women are often dismissed. Historically, women's pain has been minimized. We're told, it's stress, it's anxiety, you're overreacting, your blood work is normal, just come back in 6 months. But here's what the research shows. Women wait longer in ERs than men with equivalent pain, are less likely to receive adequate pain medication, and are more likely to have physical symptoms attributed to psychological causes. This is called medical gender bias. It is documented, it is real, and it costs women years of their lives in undiagnosed, untreated conditions. Advocating for your health is not dramatic. It is not being difficult. It is responsible. If one provider dismisses you, seek another opinion. You are allowed to bring notes. You are allowed to ask, what could be causing this? What tests would rule out X? You are the expert on your own body. 10. What you can do starting today. You don't have to wait for a doctor to take you seriously. Start tracking cycle length from the first day of one period to the first day of the next. Pain levels, rate them 1 to 10 and note where it is. Bleeding patterns, pads or tampons per day, any clots. Mood, specifics, depression, anxiety, anger, brain fog. Fatigue, when it's worst and whether it ties to your cycle. Bloating, digestive changes, and hair shedding. Do this for 2 to 3 cycles. Patterns reveal truth that a single snapshot appointment cannot. When you see your provider, bring that data. Request specific blood work if needed. A complete blood count, CBC, to check for anemia. Ferritin, the stored form of iron which drops much earlier than iron itself. A full thyroid panel, free T3, free T4, and thyroid antibodies, not just TSH. Hormone levels, estradiol, progesterone, testosterone, LH/FSH. Vitamin D, B12, and magnesium. Fasting insulin if weight or energy issues are present. And trust your intuition. Your body sends signals. Your provider's job is to investigate. If they won't, find one who will. You are not dramatic, you are not weak, and you are not crazy. Your symptoms matter, your pain matters, your quality of life matters. Women lose years of their lives to conditions that were diagnosable and treatable because they were told to accept them. You don't have to. If this video resonated with you, comment, "I deserve answers," because you do. Subscribe for more real conversations about women's health, because what's called normal isn't always healthy, and you deserve better.